I'm Kelsey Howell. I'm here with Mary Caitlin Mina and Breeze Burrows. We're with the Mississippi University for Women Bachelor's of Science in Nursing program, and this is Crohn's disease. What is Crohn's disease? Crohn's is a chronic inflammatory bowel disease that causes swelling and sores deep in the layers of the tissue along the digestive tract. It can affect any part of the gastrointestinal or GI tract from the mouth to the anus. However, it most often affects the area in the last part of the small intestine and colon. Over time, Crohn's can lead to intestinal blockage from inflammation, weight loss, blood in stool, or fistulas. A little bit of the history of Crohn's disease. Dr. Beryl Bernard Crohn, with his two colleagues, Dr. Gordon Oppenheimer and Leon Ginsberg, formally discovered this disease in 1932. They originally termed the disease regional ileitis, but it became more commonly referred to as Crohn's disease. They identified 14 patients whose symptoms and intestinal abnormalities discovered at surgery, while consistent with each other, did not fit any other previously identified disease. The incidence and prevalence of Crohn's disease. The annual incidence of Crohn's disease ranges from 1 to 10 cases per 100,000 people annually, depending on the region study. That incidence appears to be rising. The peak age-specific incidence occurs between 10 to 20 years of age, and second peak, that's smaller, occurs around 50 years of age. The prevalence of Crohn's disease ranges from 10 to 70 per 100,000 people, but some North American studies have shown prevalence as high as 200 per 100,000 people. There also appears to be a north-south gratitude worldwide, where population in higher latitudes such as Scandinavia, Canada, and Australia have higher incidences than populations in lower altitudes such as southern United States, Spain, and Italy. In the United States, males and females are equally affected, but both whites and Jews are much higher risk of developing Crohn's disease than the rest of the population. Immigrants moving from a low-risk region to a high-risk region have a risk of developing Crohn's disease that is similar to that in the high-risk region with one generation. Some risk factors of Crohn's disease include age, ethnicity, family history, cigarette smoking, the use of NSAIDs, and the environment. The patho of Crohn's disease is believed to be due to a dysregulated pro-inflammatory response to commensal gut bacteria. Due to mutations, some mucosal defense mechanisms are disrupted. Mucosal defense mechanisms include the presence of mucus-coated epithelial with tight junction, IgA secretion, and defenses. When defense mechanisms are depressed, uncontrolled microbial proliferation can occur, and NF-dependent genes are stimulated to produce pro-inflammatory cytokines like tumor necrosis factors.
How is Crohn's diagnosed? The diagnosis of Crohn's is established by finding characteristic intestinal ulcerations and excluding alternative diagnoses such as enteric infections, ischemia, diverticulitis, and NSAID-induced enteropathy. The ulcerations of Crohn's disease may appear aphthoid, but they could also be deep and serpineous. Skip areas, a cobblestone appearance, pseudopolyps, and rectal sparing are characteristic findings. On a small bowel x-ray, Crohn's disease often is manifested by a separation of bowel loops and the narrowed terminal ileal lumen, which is called the string sign. The diagnosis of Crohn's disease can be made only when other reasonable alternatives in the differential diagnosis have all been excluded. Testing and procedures that are done. Blood tests are done to test for anemia or to see if there's any blood in the stool. Colonoscopies are the most common test. This test allows the doctor to view the entire colon using a thin, flexible, lighted tube with an attached camera. During the procedure, the doctor can also take small samples of tissues for lab analysis, which also may help confirm a diagnosis. Clusters of inflammatory cells called granulomas, if present, also help confirm the diagnosis of Crohn's. A CT scan may be done to see if the entire bowel, as well as the tissue outside the bowel. An MRI is particularly useful for evaluating a fistula around the anal area or the small intestine. For this test, a capsule that has a camera in it is swallowed and takes pictures, which are transmitted to a computer you wear on your belt. The images are then downloaded, displayed on a monitor, and checked for signs of Crohn's disease. The camera exits the body painlessly in the stool. Small bowel imaging looks at the part of the small bowel that cannot be seen by a colonoscopy. And how is Crohn's treated? The primary treatment for Crohn's disease is medication and surgery. Nutritional methods and alternative therapies can also play a role in managing the disease. Research shows that antibiotics help control symptoms of Crohn's by reducing bacteria in the intestines. Aminosalicylates like aprezo decrease inflammation in the lining of the colon. Corticosteroids work by suppressing the immune system throughout the body and are generally used as a short-term solution to induce remission during a Crohn's flare-up. Immunomodulators such as Imuran also suppress the immune system and can be used to replace steroids on a more long-term basis. Biologics are antibodies grown in a lab that stop certain proteins in the body from causing inflammation. An example of a biologic is Remicade. The purpose of surgery is usually to relieve severe symptoms of Crohn's disease or to repair or remove damaged portions of the intestines. And how do people live with Crohn's disease? Crohn's is a chronic illness that requires many lifestyle changes. While dietary choices do have an impact on symptoms, it is not caused or cured by any particular food. Generally, people with Crohn's should aim to have a nutrient-rich, well-balanced diet with plenty of fruits, vegetables, grains, and lean sources of protein. It is also important to keep hydrated. Increased stress can cause Crohn's symptoms to flare. It is important for the patient to learn to cope with challenges and to manage stress. Accommodations at work or school will help make living with Crohn's somewhat easier. Perhaps a desk or an office moved closer to a restroom can be beneficial. Some ethical considerations with Crohn's disease. Anemia or blood loss is common in patients with Crohn's disease. It can be caused from rectal bleeding, surgery, or immunosuppressants such as Humira. This can become an ethical issue with certain patients that refuse blood products due to religious beliefs, such as Jehovah's Witness. It is important to thoroughly explain risk and possible complications to patients.
The family dynamics with Crohn's disease. When caring for a patient with Crohn's disease, the family dynamics can change. There can be a caregiver role strain due to the demanding amount of time it takes to get the patient to and from the doctor with clinic visits and going back and forth to the pharmacy. The wife may then have to get a second job or hire a second person to help with care if the husband is the one with the disease in this scenario. Expenses involved with Crohn's disease. According to the National Center for Biotechnology Information, the average overall cost of living with Crohn's disease is around $18,000 per patient per year in the United States. Hospitalizations account for an average of 55% of the medical cost, and as you can see with our pie graph, it's obviously a little more than half of the overall cost. Indirect costs account for 28% of medical costs, which is this section. Indirect costs can include the lost earnings from being absent from work, sick leave pay, early retirement, reduced employment, and reduced opportunities for unpaid activities. The direct costs in this section they account for 23% of overall medical costs. Direct costs include pharmaceutical cost and the cost of treatment associated with this disease. Some support groups for Crohn's disease or people living with Crohn's include the CCFA, which is the Crohn's and Colitis Foundation of America. There's also a Living with Crohn's Facebook page and support group. And there's also local support groups sponsored by local hospitals or community health centers. Even some community health nurses may know where you can contact somebody for a support group. Problems associated with Crohn's. Pain related to irritable intestinal inflammation, abdominal cramps, and surgical response. Risk for infection related to development of inflammatory process or worsening disease process. Fluid volume deficit related to excessive vomiting and diarrhea. Imbalanced nutrition, less than body requirements, related to the inadequate nutritional intake secondary to pain, stomach, and intestinal inconveniences. And fluid and electrolyte imbalances related to discharge of excessive vomiting. These are the 5 problems associated with Crohn's that we use to do our care plan for this patient. Our plan of care for this patient includes, for the problem of pain, we would assess the level of pain using an appropriate pain scale, administer pain medications as ordered and as indicated. We would have the patient maintain bed rest and alter their activity according to their tolerances. Incorporate non-pharmacological measures to assist with control of pain, such as maybe heating pads, ice packs. Risk for infection, we would assess vital signs including temperature every 4 hours. We would monitor the labs to include white blood cell count and report abnormal findings to the doctor. We would monitor any surgical incisions every 4 hours and as needed to watch for an increase in redness, infection, or anything abnormal that we might need to report. Administer antibiotics as ordered to prevent infection prophylactically or to keep the infection at a minimum. Fluid volume deficit, we would assess the skin turgor and color every 4 hours to watch for dehydration. Replenish fluids with IV fluids as ordered, and also we would replenish fluids with their diet. We would provide the prescribed diet. We would alter this depending on their symptoms and how they were tolerating their diet. We would also monitor lab values to assess for depletion of fluid volume. With imbalanced nutrition, less than body requirements, we would monitor their intake and output closely, be on strict I's and O's, and provide a prescribed diet. That way we could regulate better their I's and O's. We would provide dietary supplements or parenteral nutrition if needed. Provide the patient with foods that the patient prefers rather than just what's available. We would also provide foods at a time that is good for the patient, usually the regular eating schedule of the patient, to make it easier and make it a little easier on them. Risk for fluid and electrolyte imbalance, we would need to monitor their lab values to include sodium and potassium closely. We would monitor intake and output every 4 hours. Monitor the patient's level of consciousness and heart rate and rhythm every 4 hours and PRN. We would also assess the patient's dependent extremities for edema every 4 hours to make sure they were not retaining any excessive fluid that we might need to care for. Other problems associated with Crohn's disease, these are some more from our plan of care. They include situational low self-esteem related to the prognosis of the disease process, frequent hospitalizations, and excessive vomiting and diarrhea. Social isolation related to pain and frequency of bowel movements. Risk for activity intolerance related to pain and frequent bowel movements. Interrupted family process related to change in family dynamics due to the prognosis of the disease process. And anxiety related to the prognosis of the disease and frequency of hospitalizations. These are some of the resources that we use to complete this PowerPoint, and this is Crohn's disease.
As a GI nurse, this is something we use at the clinic to explain to patients who are newly diagnosed with Crohn's, especially younger people, exactly what Crohn's is. And here's an example of like the intestine. And this can be like inflammation, where the lining of the intestine swells and becomes irritated. Sometimes when they do a colonoscopy, they can see like ulcers and fissures and strictures and even fistulas. And fistulas are tunnels that create connections from part of the intestine to another part that shouldn't be there, like a hole that's created. And this is like your esophagus that goes down into your stomach, into the small intestine and large intestine. And these are just some of the symptoms that people are diagnosed. We can explain to them some things that they might experience in their intestines, including all the symptoms that were listed in the PowerPoint, like diarrhea, abdominal pain, cramping, bloody stool, weight loss, fatigue, fever, rashes. And like we said earlier, the definitive cause of Crohn's is still unknown. It could be like environmental, hereditary, genetic, but the definitely risk factors include like cigarette smoking and pollution and other things like that. Males and females are equally affected, and the average age of diagnosis for Crohn's is 15 to 35 years old. And some home remedies, people always want to know about their diet. What should they eat? What should they not eat? And like we said, no one food causes nor cures Crohn's disease, but you can manage a lot of it with your diet. Probiotics definitely help restore good bacteria in the digestive tract, which enhances digestion, absorption, and processing foods. We recommend unprocessed foods, green tea, carrots, ginger, turmeric are all things that we recommend you use in your meal planning as well. And common medications, like we said earlier, corticosteroids, immunomodulators, and biologic medications. So this is just something that we like to have available for people that have questions and are visual learners. Do y'all have any questions about Crohn's disease? All right. Well, thank you very much.
You did good. Thank you.